Hi, guys. So we've got here somebody that I have just so much respect for. My friend, Lara Heimann. So happy to have you here, Laura, who just is an amazing yoga teacher with a background as a physio and has a super awesome podcast as well, all about movement. So she's going to join us here to lend some of her expert and knowledge and wisdom about movement and specifically around hypermobility. So Laura, why don't you just go ahead and tell us a little bit about yourself?
Well, thank you for having me on here, Hypermobile Yogis. So a little bit about myself. Well, in a nutshell, in terms of what I do and what I love, I've been a physical therapist for over 20 years and a yoga teacher the same amount of time, essentially. I graduated from grad school and shortly thereafter started practicing yoga, and then shortly after that started teaching it. And just over the years have been experimenting with myself and with my students and with my patients, and just blending these two disciplines to create kind of one viewpoint. I don't really separate physical therapy and yoga. I look at it all as movement that can enhance our well-being and that should enhance our well-being. And in doing that, it's really a wonderful practice of paying attention in our lives. I really feel like how we move in our body is a very accessible and very practical way of paying better attention to the way we live our life. So I do a lot more than that, but I think that's a good start.
It's absolutely amazing, Laura. And so, yeah, we just want to say a huge thank you for deciding to join us. And as Adell mentioned, this is our little project just to see if we can help inspire people who've got hypermobility on how to take care of themselves a bit better. And so the first question that we've been asking people is really, with the knowledge that you've got and with all the different people that you've worked with that have hypermobility, like, what is your current approach to maybe just giving them a little bit more help and understanding? And in addition to that approach, what are some of the tools that maybe you found has been really effective in supporting these people?
Well, first, I think for hypermobile people, I am always very careful with language. I think I am anyway. I feel like the way we speak, even the way we're speaking to each other now, I feel like we should always be raising the bar on communication. So I think communicating what I would like a person to think about or focus on is really important. And it's especially important for people who are hypermobile because their communication in a way is muffled. The nervous system communication. They're not getting fast, clear communication from their nervous system about where their in range of motion is. So I almost feel like my communication as a teacher and as an educator has to be so heightened and specific and really clear, because I almost have to make up for the lack of communication that person's getting. So, but I take that to everyone, even if they're not hypermobile, I want to be really clear in a yoga setting. And so I don't want to ever kind of emulate or provide a lot of praise for hypermobile people. That is unfortunately done a lot in the yoga world. Somebody who's hypermobile, people make a lot of assumptions and think that they are just great yogis because they're representing this ideal of what we think yoga should look like. So I think that we should watch our language, that we're not telling people that this is the ideal. And so when we do that in a group setting, and then in particular with the person who is hypermobile, my hope is that they won't think that, they've just naturally got it and that we're just going to leave them alone. So what I do instead is say, I notice that you're going to in range, and what I want you to do is back off of that and find your strength. So the tagline that I use over and over again is go into your strength, not into your flexibility. That's easy for you. What's going to be more challenging and a lot more sustainable and healthy is going into the strength of how you actually hold your shape. Because I look at them, people that are really hypermobile, because they don't have that strong communication that's saying, whoa, back off. You're going to joint space. You're going into articular structure. You're going into ligaments. You're going into stuff that's not really made to just hold you there. It's supposed to be like a little guardian, but you're like hanging out in your guardian. So because they don't have that communication, I'm going to provide it and really tell them to back off and go into the strength. And so that has worked really effectively. What I find that has happened with people is that if they've practiced yoga a long time and they've just got lots of praise for doing this in a certain way, sometimes it's confusing because I'm coming in and being like, whoa, you need to back out of that. And so I find like I have a lot of I read the energy from that person. Some people are so grateful. They're like, wow, no one has ever told me that. And this is way harder. I never even felt anything when I was doing this, because they're just kind of like flinging around. So for that person, I'm like, it's okay. This is where you start now. Know that you need to back off of this, and that they're very eager. Then there's people who are a little resistant because they've really gotten used to that kind of like, well, praise and touching this and leaning into that. And for that person, I'll just try and say, hey, I'm on your side here. What I want you to do is I want you to do this for many, many years. And I'm afraid if you continue to practice in this way, you won't be doing this for many years.
Yeah, that's good.
And that's where my professional background does help, because that tends to stop them a little bit in their tracks. I don't like to go into like the negative, but I will use that if I have to, just because it's always coming from a place of caring. So I just kind of read those people and I'll communicate differently based on what those particular people are kind of signaling to me with their energy.
Yeah, I'm sorry, I just chipped in, but I was like, oh my God, you're just giving them the credibility to back up the fact that what you're saying comes from this depth of knowledge. It's not just an aesthetic-based practice. It's actually understanding the repercussions of our actions. And I feel like, for me personally, when I look at the yoga world right now, there aren't enough people that understand the repercussions of what we are doing in the yoga practice. And, I posted a post on Instagram the other day, just basically talking about how one of my students, she had done her first private class with me, and she was saying, oh, she had a bad back. And I was like, oh, why do you have a bad back? And she said, well, I hurt it doing drop backs, but I wanted to do Mysore every morning. And the teacher said I had to keep doing drop backs to carry on in the series. And so my post was just empowering people, telling them, look, you have a choice. You shouldn't listen to teachers if it hurts. But the backlash that I got from Ashtangis, thinking that I was, vilifying the practice of Ashtanga, really it was so sad actually that they didn't get the point. Yeah. And I totally agree with you. I mean, the experiences that you're listing out, I've had the exact same experiences within my students as well. So it's so refreshing to hear someone else that is going through the same thing.
Yes. And, honestly, I've been saying it for a long time. So I will tell you from having more kind of years now under my belt, we're at a great point. There's going to always be people that are resistant. And I think that just tells you a lot about the person, that they're like, I just want to, because I know all of us can be like, wait, we have our point of view, and I feel like I want to be open-minded, but there's some things that, it's not about open-mindedness. It's actually about understanding the body. Mm-hmm. And I would say there's a good reason why there's not a lot of Ashtangis that are practicing in their 60s. I don't see a lot of them. It's just very hard on the body. It's really, if that's all you're doing, and you're doing like following these teachers that are telling you to go into these in ranges and putting your joints in kind of non-functional positions through force, then I don't think you're going to be practicing for decades. And I don't want that for anyone. My whole goal is I want everybody to have a happy and healthy practice for decades. So it isn't about bashing a particular type, but on the other hand, just like I don't want to bash something, you can't glorify a particular type if it's harming people. and there's just enough bodies out there, but literally bodies of evidence that point that these certain styles and lineages are not sustainable. You don't see these older generations practicing them because they just can't.
Yeah. So one of the questions that I wanted to ask was kind of quite general and broad. Is yoga helping or harming the hypermobile population? But because what you're speaking about, I think, is not only helpful for hypermobile yoga practitioners, but probably a lot of yoga teachers out there are going to be listening, like with a little bit more interest here, going like, okay, how can I be a good yoga teacher to my hypermobile students? And so speaking maybe to the yoga teachers out there, how would you what would you say for perpetuating yoga as something that's a lifelong practice and helps us go into old age feeling strong and healthy?
This is so important, really so important. I'm so really happy and grateful that you all are giving voice to this. As teachers, I just feel like that's what we have to do, teaching and educating. It's not just instructing and regurgitating. And so I think that teachers, first of all, there's kind of two pockets. Teachers that are already teaching should always be examining if they feel like they are upping their own knowledge, and that what they're saying, if everything, like when I'm talking, especially in the classroom, I'm listening and I'm like, does this actually make sense? Because I describe things in a variety of ways that I know have worked for individuals and for myself. And if something doesn't land, I'll try a different way of saying it. But it makes sense. It's not like just like I'm reciting something that, my teacher or somebody told me, and I'm just saying it, but I don't actually understand the deciphering of it or the kind of context of it. People will say things and they don't really know. I mean, I've had so many teachers over the years who have gone through my training, and they're like, I said this, dig this toe in and slide your quadricep up, but I never really understood what it meant, or what it was supposed to be doing, like in a triangle pose or something. They kind of just had been taught that. So I would say first, as teachers, educate yourself enough about functional anatomy. You don't have to be a physical therapist. You really don't. There's so many great people like yourselves that are learning without having to go get a degree. It's your body. Just think about it and really analyze. And if you don't know why you're saying something, then don't say it. Really be very clear about saying things that have meaning to them. The other thing I think that teachers really should watch in their languaging and in their instruction is encouraging people to go to the depths of something, hold it there, that some kind of pain is a good thing. Just breathe through it. This kind of lingo that is coaxing people to go deeper into poses than they should be. And then I would say some of the things like binds with the arms under the legs and things, I would always be like, what is the point? Right? What is the point? I always am like, I have had people that have messaged me on Instagram, and my heart goes out to them when we go back and forth, I finally ask, well, why do you think you should be doing this? Right? Like, I really want people to actually think for themselves. Because they'll be like, well, I did this and I injured myself. I was ended up in the ER. I mean, I've had people literally say, I've ended up in the ER. When is it going to be safe for me to start stretching again? And I'm like, wait, you injured your upper hamstring doing a bound triangle. And then I just said, I'm not snarky. I'm really genuinely curious. What makes you think, why are you so focused on that? Like, what is it about that? And she's like, I actually don't really know. So I think we have to become critical thinkers. I mean, this is why yoga is our path for life. We need to be thinking about our actions in our lives, and some things that we do out of habit every day, are they really the best thing we should be doing for ourselves and for the environment around us. I think it's just such a great practice for everything, examining with a critical thinking eye and lens of how we're living our lives and impacting ourselves and others. So I think as teachers, we have to stop thinking that blocks are somehow less than. That is, fortunately, I think, not as much as it was 10 years ago, but I've always used blocks a lot. And I remember I would travel, and teachers at other studios would say, well, how do you get your students to use the blocks? They just think that, like, oh, I don't need blocks. And I'm like, well, I make it like the blocks are the most amazing things. This is going to bring you more strength. This is going to bring you more connection and integration. Use the block. It's like, this is not a option. Take the block and use it, right? So you as an instructor you're in a position to guide people and to really instruct them and make them go more into these lines of inquiry, and never again stop applauding. Like if somebody can bind, okay, but I found I don't even instruct some of these in-range stuff anymore. I just don't. I can do a bind. I think binds feel really great. They feel great for me because I know what I'm doing and I'm integrated. But to use that as a model when I know that maybe people who are really, really bendy, binding might just put them in their end ranges, and then the rest of the population are going to struggle to get in a bind and perhaps even wrench some things they shouldn't. And all for what? Do we bind in life? No. There's other ways of opening up our shoulders that I think are a lot more effective. So that was kind of a long-winded answer. I hope that helped. But I think as an instructor, we have to really be courageous and stop just regurgitating crap that doesn't make any sense. And that's not going to help people.
I think it comes back to that just single word question, why? Like whether you're a yoga practitioner and you're in your yoga practice, or you're a yoga teacher in your yoga practice, or teaching a class to others, always ask yourself why. Or if you're just out in everyday life, whatever it is that you're doing in life, if you're doing it completely mindlessly with no real reason for it, just out of habit or because other people told you to do it, then you really need to ask yourself that question, why? So yeah, and I think that is the beauty of yoga, is it does, as you mentioned, Laura, it kind of teaches us how to go into this self-inquiry and get to know ourselves.
And be satisfied. There is we should be satisfied with what our bodies can do at all the different stages. That doesn't mean we don't want to optimize. I think optimizing performance is the ultimate umbrella goal. And that could be optimizing performance so that you just feel better in life. That could be optimizing performance so that you can, practice your soccer with more, sustainability, endurance, strength, and all that kind of stuff. But it's really an optimization, but it has to come from like where you are at that point and where you can grow. But yeah, then there's and then everything should be like, well, why is this going toward that goal of optimizing, or is this just some kind of random, it is, because a lot of things that we do in yoga are a little random, I think, sometimes.
I always like to joke that, unless you decide that you want to be able to brush your hair with your feet, why do you want to get your feet to your head?
It doesn't make sense.
Yeah.
And if you've got this goal, for whatever reason, no, I'm never going to brush my hair with my hands again. I'm going to do it with my feet from now on. Then fine. That's cool. That's your thing. But have a reason.
Yeah.
Have a reason.
Have a reason. And I think it just, and that's where it really uncovers a lot of our cultural tendencies of having these just checklist goals. I find that a lot of people have that, and there's nothing wrong with it, but again, why? Does it make you feel fulfilled, or can you be okay? For instance, so if somebody were asked me well, why handstand? I could say, do you have all day? Because I could tell you all the reasons why I think a handstand is great. If they said, well, how about a split? I would say, if you never do a split, that's fine. You know what I mean? It's not that functional. There's a lot of kind of problematic stuff with it, or you might not get injured, but like forcing yourself to work on a split all the time is going to have a lot less kind of overlapping functionality to it than working on a handstand. So I can really kind of tease that out. But if you're really interested in doing a split, okay, then work on it, but do it really mindfully and be okay with that. You might not ever get there, you know?
Lara, can you shed some light on or give us your opinion on yin as a style, purely because we're getting a lot of questions about that. And although Adele and I have got our opinion on it, we feel like we're not really coming from a place of great knowledge with it. And so we would love to hear your opinion on yin, and especially with the realms of hypermobility.
Yes. So I've been asked this question a lot. And what I always want to phrase is that I never mean to be snarky, and I'm always coming from a place of like, if somebody really loves something, so somebody might love running 100 miles a week and that's all they do. And, you know, my opinion is that's not a really great thing to do for the general population and probably for an individual, because it's just the same movement over and over again. And that it's not that's running bad, but I wouldn't want to take that away with somebody. I would want to try and work with them and be like, well, if you do that, you should add some of these lateral movements and these types of mobilizing stuff for your hip. So for yin people, if they love it, I would say, like, why do you love it? Like, what is it about it? So a lot of people that have written me, they like it because for the most part, it has something to do with how it makes them feel in their nervous system. It's a relaxing, it helps people with anxiety. So I would tease that out and say, okay, well, restorative is amazing for that as well. It really has an effect on the parasympathetic nervous system. And the difference is you are supported in restorative. You are truly just like letting go and you have support. The problem I have with yin is it's trying to kind of be too many things. And I don't think it's really successful at it. I don't understand it from a PT standpoint. You're asking somebody to stay in a pose for a pretty long time, way too long to have any long-term effect on the tissue. And asking to have enough activation that's protective. But again, most people aren't able to do that for that sustained period of time. So what you're really pretty much get, like for frog, for instance, frog pose, I don't understand it. There's so many other ways of getting into your adductors, getting external rotation in your hip without getting yourself in that position and your body weight and gravity in that position where you're pressing into your joints. And then you're asking somebody to stay there for, I don't know, 5-7 minutes. Yeah. So it's putting, and for hyper flexible people, that would be a really detrimental thing to do because they'd be able to hang out there. They'd be able to hang out there for a while. And there's no way that they're going to be able to hold any kind of productive activation around the joint space that they're not sinking into those into the joint itself. So the issue with yin is the amount of time that you're asking people to have some activation, but not a ton, so that you can get some relaxation. But you can work the nervous system very effectively in a lot of other ways to get that relaxation. So serotonin is going to go up when you are doing increased activity, when you get your heart rate up. So doing something with much more physical exertion, and then working on the adaptability of the nervous system to then be able to ramp down and know like, oh, now I'm going into Shavasana. I'm kind of going onto the floor and easing into the parasympathetic state. I'm way more interested in somebody being able to do that than being able to hold a position and find some calmness in it. I think it's asking the nervous system to do too many things at once. It's trying to override your protective mechanisms in the nervous system by holding something long enough that you are overriding it. These Golgi tendons that are in the joints that activate when you're getting into in range, you're trying to override that message. And I don't think that's a good message to override. So I don't understand it. I don't want to spend 50 minutes of my time doing that. I honestly, unfortunately, have seen people who have gotten injured in yin. I will say yoga, just like other things, isn't going to injure you. It isn't let me rephrase that. It isn't the cause of your injury. The cause has been the foundation of it has been there. But if something that you're doing in yoga could then create the injury, that's not good. We want yoga to create more balance, not more imbalance. And I think yin is going to probably create more imbalance.
Okay. Thanks. I wish I could memorize everything you've just said because I get this question quite often, and I don't know if I do the answer any justice, but the way you summed it up was so clear and precise and scientific. And I just feel like I'm so grateful that I'm having the opportunity to listen to your explanation, because it just makes so much sense. So
yeah, and I think yin has come into our lives in this modern day life. And the reason it is caught on is because there's something to it that people crave. They are craving a stillness. They are craving their calmness in the nervous system. So I think those are all valid things. I think there's other ways of getting it without putting yourself in these positions where you're supposed to be opening the fascia and holding it. It's just, yeah, I think it's confusing. So anyway, but you can certainly write down anything I just said.
Yeah, I'm going to actually, without a doubt.
Yeah, definitely gonna watch this video back with my notebook.
Oh man, completely.
Yeah.
I mean, given all your experiences and stuff, are there any like really practical, positive steps that you can kind of throw at hypermobile people on this, like just a few suggestions maybe that we can take away and implement and maybe see a change in our quality of life?
Well, I think I'm a really big fan of what's called developmental sequence. And that's really, I teach it in my teacher training. It's, if you look at the way I teach my classes online, every single one of them goes through the developmental sequence. This is what I learned in my postgraduate certification, which is called neurodevelopmental training technique. And it really applied to people who have sustained some kind of brain injury or have some kind of neural disability, but you can apply it to people. I mean, we all have a brain, and so it can be applied to anyone. It doesn't have to be just for the person who's had a neurological insult. So it's really great for people who don't have all the feedback, that communication I was talking about. So that is simple stuff like working on your bridge pose, working on bridge pose in a variety of ways with one-legged bridge, keeping the pelvis very neutral and keeping this feeling of everything around the container of your core, your rib cage, your spine, your pelvis, hugged in like you're just trying to snug in everything, because everything is more like, So starting off on your back, which is called supine, working in prone, the same idea, not going into like huge ranges of like a locust or something, but think first about going right into around the spine itself and tightening there, and then the muscles from that place out. So it's going to be smaller movements, but going into the trunk, the core stability, the postural muscles. The next phase would be on all fours, quadruped, and moving one arm and one leg or both at the same time with minimal, if not any movement anywhere else. So in physical therapy, one of the, when we really analyze things, people that are like me that are very into biomechanics, the saying is that if we detect any lumbopelvic movement, it's too much. So that means like when somebody's walking or moving a limb in that quadruped, if I see the movement of your lumbar spine or your pelvis, is already too much. There should be about 5 degrees of movement at that place. So for people that are hypermobile, this is going to be huge, because a lot of them are hypermobile in that lumbopelvic junction. So where the lumbosacral area is into the pelvis, that's a really loosey-goosey area. So to stabilize there is difficult. So something on quadruped, and then moving up from there, the next stage of developmental is called half kneel. And so when I do lunge, when I teach a lunge, Anjaneyasana, I don't teach the like splaying onto it. I want people to feel that hugged in feeling in their Anjaneyasana. So it's really more like a half kneel. That front foot is in quite close and the shoulder is over the pelvic girdle, so that there always can be this energetic stabilizing hug of the core. And then you can start to move bigger. But for somebody who's really, and I have quite a lot of people, you know, we have different names, hypermobility, increased laxity of the joints. This is where we focus. And a lot of times that's all we'll focus on for sessions. I mean, a dozen sessions, we're only doing just stuff on the floor. Because then when you get into the bigger movement patterns where you have less of the feedback from the floor and more possible mobility in your joints, you want to have that, what's called neural mapping, already intact. So it's surprisingly so challenging. Most people love it. Some people are like really grumpy about having to, what they would think is regress.
Yeah.
Because they're going from being really like expressive to much very contained. I call it almost robotic. You want to get very, very robotic in the movement. But that's how you'll lay down those newer neural tracks for that controlled movement.
It's for sure what I had to do in my practice. And it was, I mean, to say humbling isn't even the word, because I can do some serious badass shit with my body. Sorry to swear, but I was doing these almost imperceptible movements and shaking and sweating and so tired for hours afterwards.
Yeah.
I mean, it was just mind-blowing. And sorry, Adell, I've asked all these questions now. You need to also ask questions. I've just got one more that is burning inside me. I can't wait to ask you, Lara, is one of the things I hear a lot of yoga teachers saying, let's imagine your student has done all that groundwork and they're pretty stable, actually, and they're moving quite healthily. They've got that core activation. Would you say it is contraindicated to move, for example, from a warrior 1 to a warrior 2? Because some yoga teacher trainings are quite hell-bent on the fact that that movement pattern is super bad. You need to choose one or the other and stick to that. And I just think, personally, from my experience, that your body is doing that kind of weird stuff all day long. Like, why would you suddenly in a yoga class take that away because it's contraindicated? Like, it doesn't make sense to me. But I would love to hear your opinion on this.
Well, I will say this. I don't teach warrior 1 to warrior 2. And I don't think it's contraindicated. That would be like a fairly strong word. But for me, it's more like, I want to move in a way that feels really fluid. And that doesn't feel very fluid, mainly because you have the back foot in weight bearing and we're on a sticky mat, and so we're moving, and the pelvis that's movement of the pelvis on top of the femurs, and it doesn't really move a lot. So something else it feels kind of sticky. So I'd much rather go like crescent lunge, where the back heel is free, and then go into warrior 2.
Okay,
so,
that is more what I teach.
Yeah, that's fine to do. It's not like, it just is more that it's I don't think, listen, that per se is not going to injure you like some of the other things could. It just feels a little wonky. That's mainly what I would say, is that it just doesn't feel as good. Like if I was going from a sagittal plane to a lateral plane, I'm not gonna have that back foot grounded. No matter what I'm doing, I'm gonna pivot on it or you know what I mean? So I would say more than anything, it just doesn't feel that great.
And what about, for example, moving from like a warrior 3 into a half moon? People are like, no, you should never do that. I'm like, I don't know. Is it really that bad?
Again, it's actually, I have a half moon class coming up on my site. And that's actually a really strengthening gluteus medius move for the bottom leg and the glute med. And the glute max. But the problem is it's how you instruct it.
Mm-hmm.
If you were in that warrior 3, and you don't have the hip, the space here. If you have sunk into it and then you do it, it feels like kind of like, you know. But if you keep this hip joint space and lift and turn, it's actually a really great strengthening move. Yeah. You just have to instruct it well. Like your, what I try and say is, imagine like your pelvis is floating on the top of that femur. You want to maintain that little space there. That means the femur is centered in the pelvis. It isn't kind of jammed on any of the sides of it. And then it can rotate right into a half moon, no problem. But if you've sunk, which people do, they get in there and then they sink out into this, their femur is not centered. So then they go over in a half moon and feels a little grindy. Yeah. So I think it's a great opportunity to tell people how to do it, So it's a lot of core strength.
Thank you.
Sure.
Cool. Well, I think I'll just kind of finish off with just one last question, which is, is there any other resources that you think would be really interesting for hypermobile people? Any books or courses, or just any last advice in general for people to kind of educate themselves a little bit further on this condition and how to turn it into the way that we're talking about it is that hypermobile people are like superhumans in training. So to turn their hyper flexibility into a superpower.
I love that. I'm trying to think of other resources. I mean, I think just in general, doing a lot of core engagement work, and that isn't just sit-ups or anything like that, but all the stuff we just reviewed, all the developmental stuff, having a lot of weight bearing in the hands, because all that weight bearing in the hand, whenever you have weight bearing, first of all, weight bearing is going to be really important for this. Whoops, dogs are. Whenever you have weight bearing, you're going to get a lot more responsiveness of the core, because there's these different physiological principles that make it's like it charges up the core. So I would do a lot of things weight bearing: plank, forearm plank, side plank, modified side plank, and longer holds for these people in the strength, not in a stretching way, in strengthening, working really hard and getting charged up about that. I would say do core strengthening on your hands, on your legs, and work on these stabilizing features of it.
Well, that sounds like awesome advice. Wow. Yeah. I want to just talk to you another hour and maybe even call you back again next week.
Again, let's have another date, and this time I'll make sure.
We have to interview you again, yeah. Lara. You're absolutely.
I would love it. I love it. Oh, stop it, guys. I love talking about this stuff. Hold on, I'll take this over here. Those are my pups. They're saying, move well, be strong.
Bless you, Lara. You're absolutely incredible. It has been amazing listening to you. Thank you for everything.
Yeah. So where can people?
I'm so honored to be on here. Thank you so much for thinking of me.
It's our pleasure. Just let everybody know where else they can find you if they want to get a little bit more information about you or learn from you online.
Great. Thank you so much. Well, on Instagram, it's Lara. It's Lara. There's no U. Lara. Heimann, Heimann, Lara Heimann. And then I have a website, Movement by Lara, Lara, movementbylara.com. And that has a lot of information on it. It has my podcast, my daily classes. In 2.5 months, I've recorded 79 classes. So that is something that I would say I'm really passionate about, is creativity. So check those out. There's a free trial on that. And then if you're ever in Princeton, New Jersey, I have a yoga studio. Adell has been to it. It's Yoga Stream, and that's yogastream.net. So those are some places to catch me. Yeah, my podcast. Oh, yes. So podcast is Movement by Lara. The podcast name is Redefining Yoga, which I think we're all about right now, right? So it's Redefining Yoga, Movement by Movement by Lara. And you can find that on all the podcast channels that you would normally find podcasts on.
You're quite a busy lady.
Oh, thank you. I am. I have a lot. I have to tell you, I have a lot of help.
Well, you deserve it. And, you know, you're spreading a message that both Adell and I are so passionate about. I'm so tired of hearing people being injured from yoga. It should be the opposite. They should be healing from yoga psychologically and physically. And to hear that you're actually bringing this incredible body of knowledge into the practice is so refreshing.
Oh, thank you so much. We're all pulling for each other. We just want to teach the best. And we want to, like you said, yoga should be something that is fortifying us and balancing us. And I think that's always been its intention. And so we just have to have a bit more knowledge to really give people the tools to do that.
Absolutely.
Yes.
Thank you so much.
Thank you
Much for your time.
All right.
Bye.
Bye.